We're at the 22nd CROI in one of our final wrap-ups, and we're here with a group of young investigators. This is what we call our Meet the Young Investigator panel, and we've selected at random, kind of random, a few young investigators who are qualified as young investigators. That means you're under, what, 32 or 35, something like that? Yeah. I think all of you are way under that, right? Okay. And we appreciate you taking the time. My name is Schaich. I'm with IFARA, and we are going to introduce you to Alex and Bish and Nina. And they are going to tell a little bit about themselves, their affiliations, and your, let's go that far, at least at this point.
Hi, I'm Alex Medline, and I'm at McGill University.
My name is Bish Paul, and I'm at Fred Hutchinson Cancer Research Center, and I'm getting my PhD from the University of Washington.
I'm Nina Hosmane. I'm from Johns Hopkins University in Baltimore, Maryland, and I'm a fourth-year PhD student.
So a nice diversity of geographics here, even Canada.
Yeah.
Yeah. We generally have about 4 or 5 people on the panel. We generally have a doctor who will host because they're usually the mentors of somebody, sometimes the person on the panel. But this time it's a little smaller and more intimate, so we have a little more time for you to talk a little bit more about yourself and background. And we really particularly and specifically want to do this program because, and I don't mind telling people, I told you, that we are interested in bringing new people into the field. It's into the very general field of HIV. There's so many specifics within the field that you can get into, neurology and cancer and bone disease and even one thing we almost never cover is mental health, which is really a big part of HIV. It's almost like a component of every single person dealing with the challenges of living with this disease and the stigma. So it's important for us to review with people like yourself who are getting into the field, who have gotten into it recently, to the point where you're still fresh in your mind some of the challenges and the experiences you're having right up front. And so I might just ask each of you to say some of the challenges you faced, physically or emotionally or experientially, as far as the science or whatever that is in your field, and maybe tell a little bit about your field. If you will start with your Alex.
Sure. So I'm currently working at the AIDS Community Care Center in Montreal, and I would say an emotional difficulty would be seeing people suffering with HIV for the first time in a very personal context, and hearing about the mental issues that they're going through. I guess because that's new for me, so hearing those stories, hearing those very intimate accounts one-on-one with people. And then I would say with the research that I did at UCLA over the summer concerning innovations with self-testing, I would say getting follow-up from people with the self-tests that we promoted, just being patient with that, and you know, it's hard to get people to follow up with you, but you know, being persistent with that.
What's the kind of follow-up response on that? Is it, I mean, people go get a test, and this is one of those that takes more than a day?
Well, we actually promoted, they're called Aura Quick.
Okay.
They're manufactured by.
That's very quick, isn't it? I mean, that's
yeah, it's a 20-minute test.
Yeah. So
the follow-up was a self-report that we asked participants 2 weeks after we mailed them the tests, their experiences with testing and how they felt about it.
But they got the test response or the results of the test very quickly.
Yeah.
Okay. Okay.
For me, I guess the biggest challenge coming into a PhD program was because I'm an international student. I was born and raised in India. It is very hard for me to get funding. And unfortunately, as soon as I started my PhD program, that was the year that the sequester came into effect. So it was, and since then, it has been really challenging to find funding, even though the ideas that I would like to follow or the research that I would like to do is, I get scored pretty high, but I just am not able to get funding for it because I'm a non-US citizen. So I'm really lucky that I'm in a lab in Seattle where my PI is able to fund me. but in my career later on, I'm not sure if I would be able to acquire funding. But I think definitely going along the lines of what you brought up, I'm really thankful for this conference because this has made me connect my research to also the real problem with people who are living with this disease. Because oftentimes I'm sitting in my lab pretty much alone with my cells and culturing things and doing this and analyzing data, and I forget who it's affecting and how much of an impact I can actually have and why this is really important and we need to keep working on it. And yes, we also need to work on how to get funding for it.
Thank you. The emotional, I tell you, I had one doctor who was a bench scientist, much like yourself, who didn't seem to have any kind of didn't want any kind of emotional connection. And I think sometimes you kind of need a little bit about that. You need to know who it is that you're doing this for and why, and the drama that's playing out, much like she's facing. You don't have that opportunity. And I think when you come to a conference, you tend to get a little bit about that. But maybe taking a little moment to go to a clinic and seeing the challenges that she faces would be sharing that kind of that experience. I mean, you can imagine it, but it's not quite the same until you face it, is it? It's very impactful. Yeah.
So for me, those are challenges I think that I've also come across too. And for me, I think the challenge of just fighting this disease and finding many different approaches to sort of cause, eradication of this disease is what brought me into this field in the first place. Because there are a lot of amazing things happening, and there are so many approaches that people are using. There's a lot of people that are trying to create a vaccine so that we can prevent this disease in the future before it even enters, into a person. And for me, I like the challenge of really trying to hone in on different strategies and collaborating with all these great minds, fellow young minds, the minds that have been doing this since the outbreak happened in the first place. And fortunately, I also get the opportunity to go to a clinic and actually get patient sample from patients. And I remember this one interaction that I had with a patient, which sort of, whenever I get really frustrated at my lab, when I'm working with cells and I'm having a very long day at lab, I always remember this moment, and it reminds me of why I'm doing what I'm doing right now. And I met a patient, and this patient was talking to me and asking me what I was doing, asked how old I was, and I told him I was a student. And this patient said, "Keep doing what you're doing. It's people like us we're really counting on you guys to help us." And I think that moment will always stand in my mind. And it's nice going to these conferences because you meet so many people working on different things, and we're all approaching one unifying concept of trying to cure this disease, and through different avenues of awareness and education and social media, and trying to do that. So.
And how is this? That's a good point. I'd like to know more about your experience here with collegial situation, because you are alone. You're alone. You have some touch, but you don't really have collegial experiences that you can have in a place like this, with others, and especially in poster sessions where you can talk to others. Is this something that's, eventually you're going to be doing a lot of hall talk, like some of the guys and gals that have been around forever. They get to know everybody, and I know a lot of the doctors, and I'll just talk to them a little bit about something or another. But, luckily I feel very honored to have those interviews, but you all are beginning those relationships, and you'll follow them years after years after years. Eventually you'll find collaborations that you'll have to move your work forward, and those you'll see at the conferences, and you'll get to know one person after another. You'll get to know the doctors who make the presentations, and it'll become more important to you to attend a conference because of those, what we call hall talk, and those collaborations that either begin or continue, and those conversations begin or continue at the conferences. So tell me, is that something that you feel strongly about at this point, or just not at this point?
Well, this is totally new to me.
Is this all your first conference? Or?
This is the first time I've been to CROI.
And how about
This
yourself?
is the first time I've been to CROI too.
I'm a fourth year undergraduate student, so I feel like I'm just so lucky to be here because.
But you haven't been to another CROI before.
No.
See, so this is your virgin moment here.
Yeah, I just. It's a really great opportunity for me to be able to talk to PhD students, masters, doctors, so many different people, to see what options are out there for me, and I feel really lucky to be here and to have this opportunity.
Similarly for me, like yesterday I went to a talk that really inspired me. It was about advocacy, and I didn't really think that I could be an advocate, because I'm so removed from this disease. I do have friends who do advocacy efforts and I donate to them, but here someone was telling me, hey, you can actually advocate in this space in your research. And I was like, oh, thanks for telling me that. And thanks for showing me how to do that. So that was really great. And also just walking around the poster sessions, I was able to find other people who were doing similar things, or someone who was using a completely different approach to something that would really benefit me. So I was able to just talk to them, and now we have camera phones, so we just take pictures of the poster, and we're like, we're going to look this up later on. So it was really
Dig in
great.
a little deeper, right?
Yeah.
When you have time to really spend the time on it.
Yeah, I agree. This is such a great, amazing opportunity to meet people in the field that you've heard their names, but you haven't actually put faces to names. And it's great talking to people that are approaching the problem of this disease at a different angle through community outreach and advocacy, and just even in other countries, just apart from the U.S. It's really amazing how there's just so many angles to this disease, and once you focus in on something in your particular area, you sort of miss out. Like for me, I'm very, very into the technical, heavy lab aspect of it, and then here it allows me to zoom out. So I'm so zoomed in
Take that
on a daily
big picture
basis.
look, yeah, it's
And
huge.
then you zoom out and you're seeing, wow, we all are little puzzle pieces all fitting together.
Right. No
and
matter how
contributing
small
to
you are,
this
you're
big.
contributing to something
Yeah,
that's very important. Right?
every single thing counts.
It's a global effort.
It really is a global effort.
The thing that I'm most charged with is trying to find a way for you all to work together more consistently. And I know social media has made a big difference in this. When Alan Bernstein and he's from the Centers of Excellence, and we talked about, with much the same, we've done this year after year after year. And some of the earlier years we talked about developing an organization, or helping you all develop an organization for young investigators. There's a period of time there between whatever in your 20s and early 30s that it would be useful to you to learn techniques and the knowledge that would help you further you in your field. And we never got there, but it still can happen. I just don't know if it's as important as it was then, because you have everything access on the internet, tweets and twerps and whatever else is out there. But it's still, when you join an organization such as HIVMA, it is something that then you become an advocate, because that organization is an advocate. You're a piece of it. And so that's another way you can do it, or your own organization, Young Investigators Organization, or something like that. Just a suggestion. And but there are many people. You all remind me of every other single investigator that's been on this panel over the years. It's very similar. Your hopes are genuine. Your aspirations are genuinely, energized and profound. But don't be, like you say, don't let somebody tells you keep on keeping on, because it's critical. So tell us about what your hopes for your future are.
Hopes for my future. I'm looking to do a master's in public health next year, and then medical school after that.
So I'm in my 4th year PhD, and my current hope is to graduate. But looking in the future, I'm keeping my options open. I've found that I really like advocacy. I really like doing science, but I also really like communicating the science to people and trying to influence policy through that. So I've started doing some work around that. I work with the Pacific Science Center here in doing education, and I've started doing an emerging leaders program through AAAS. So I'm hoping to explore more career options than the traditional postdoc and then academia. So
Great.
Fingers crossed.
Yeah, no, that sounds really admirable, and I appreciate that. Thank you.
I'm also in my 4th year of grad school, so my current future goal is to just graduate. And then after that, I'd like to continue, hopefully in academia, and would like to hopefully sail on to become a professor.
Great.
So hopefully.
Well, you're under good tutelage.
Yeah.
And that I don't know how important that is, but it seems like, you know, I've had a number of docs who I know, you know, very well, and who their mentorees were here on this panel over the years, and it's amazing how we gravitated good people, you know, to the field, and when you're under someone like Silicana or so, they're really inspirational.
Both.
Yeah.
Both. Yeah. But is there anything else you want to convey? We have a few minutes. Just want to make sure we cover what you felt like you wanted to get out of this meeting too, because it is kind of a meeting. We talked about that earlier. It's a meeting of you to our audience, and they to you, and hopefully they'll be able to have a better appreciation for what it is that's on your minds and what your lives are like, and the challenges and mental anguish, whatever, the struggles sometimes, being in a little box in a cubicle somewhere doing things that don't seem to matter, but I can't tell you the number of times repeatedly in this very conference alone that I've talked about the incremental steps that are so critical to every single piece, you know, of the puzzle, that every single bit of work matters in some way, and may matter many times, because, I don't know, certain articles are referenced over and over and over again, you know, as being important to the publication of one other. So, and another thing I usually use a lot of is a reference to every time you answer a question, another 20 pop up.
Yeah.
Which is nice. Which is nice fun. You know?
That is science.
Frustration galore. You know, it's like a 20-ring circus. But anything else that you want to pose to the audience here?
Well, I think I would like to just say that maybe the general public have a certain definition of what a scientist should look like, but as you can see, we're very, very different.
Yeah.
And so there's a large diversity of people who are scientists, and you can just be a scientist too. It's not that hard. I mean, it is a little challenging, but it's...
We have to be bright. You all are bright. You're bright people, I know that.
That's true, but like, I think people get deterred from the path very easily. And you brought up the presence of mentors. That helps encourage you, but also just having visibility of making sure that people know that there's quite a few different kinds of scientists, and, you know, there's a lot of diversity in science that's
Yeah, actually there is a
now.
diversity in some way. You're more bench science here, but this is social, and so there's a lot of, there's so many, I would make a list and probably go on and on and on. We spend all night here making a list of all the different various applications one could strive for, or that's why I ask where you're headed, because it may be different than where you are now, and sometimes you start out in just going to school thinking that you're going to do this, and you end up in that because this seemed more exciting. All I care about is that you aspire to as great as you can achieve, the greatness you wish to achieve, and or even surprise yourself.
Yeah.
Thank you very much all for being here, and I enjoyed it.
Thank you.
Thank you.